How long does it take to see that kind of...
It takes a minimum of 6 hours for the teeth or gap to open.
Oh, really?
Yeah.
Just 6 hours?
Yeah, and if the pressure continues, the gap will continue to widen.
Wow, I didn't realize our teeth could move so easily. I mean, so in other words, if any kind of thing you're sticking up in your teeth for a duration of time, it can cause the teeth to move.
That's right, yes. Because the teeth is comprised of the root and the crown. The root is housed within the bone that's connected to the facial skeleton. And the crown is surrounded by the soft tissues. On the outside by the lips and by the cheeks, and on the inside by the tongue. So the final position of the tooth is determined by the pressures from the lips and the cheeks on the outside and the pressures on the tongue on the inside. So if anything alters this equilibrium of forces, this balance of forces, it can cause the teeth to shift
if
in any direction.
If you decide to take the tongue stud out, does your, does it go back to normal? Or?
If the gap has been there for only a short time, if you have the tongue stud removed, like what I advise my patient, the gap will just close back up. Yeah.
Well, I also understand that if you have a tongue stud, it will actually damage your enamel. How does that happen? I mean, why?
Because it's actually quite hard. So and then they're playing it around their mouth, and it may actually hit on their teeth and may fracture or chip the enamel.
And what's the implication of a damaged enamel?
Well, it can expose the dentine and lead to dentine hypersensitivity, especially when they drink cold drinks.
Sensitive teeth.
So what if it's not directly on the tongue? What if it's some people, like we had a shot there on the lip or on the side? I mean, but I guess one end is still in the mouth, you know? That's
right. This part of another form of oral piercing. And the hard part can actually be constantly abrading at the gums and cause gum recession. Yeah, and so it will lead exposure of the dentine again, and then it can be hypersensitive.
I see.
So I guess in a way it's like having a piece of chewing gum, only it's made of titanium and it's in your mouth and you're kind of playing with it the whole time.
That's right, playing, yes.
Yeah, so it's your teeth which is being remolded, not the chewing gum that changes shape. What about other bad habits? I mean, I know a lot of us, at night we grind our teeth. I mean, does that affect the, alignment of your teeth as well? Is that permanent?
Well, teeth grinding is not really a habit per se, but it's actually a subconscious response to stress. Yeah, some people react to stress or respond to stress and they develop headaches and they get gastric pains. Some people increase their frequency of grinding. As you can see in this picture here, the canines here are quite worn down, and then so are the premolars. They're all quite flattened.
In fact, my daughter is only 4, and sometimes at night I hear her grinding her teeth. I would like to think there's no stress in her life, but I mean, is this something that occurs, as you mentioned, is not unconsciously, right? Can you prevent it? Can you subconsciously?
Subconsciously, yeah. Most of the time in kids or in adolescents, it happens quite frequently. It's due to changes in when they are growing and developing, and they're actually reacting to stress. I mean, to changes in this sort of way subconsciously. Yeah, but it's quite normal. But when they grow into the adulthood and they still develop and still have this teeth grinding, then we want to seek some help in the sense that they may consider wearing a plastic spleen that covers the biting surface of the teeth to protect it from being worn down and attrited.
So I guess it's sort of natural for kids to outgrow them later, but when they become adults, it'll be a problem. But I know kids also like to suck their thumb and they use pacifiers. Is that recommended? Will it have a permanent effect on your teeth?
Yeah. Well, in infants, it's quite common for infants to suck on their thumb or have a combination of pacifier sucking. At the very latest, toddlers should have discontinued their pacifier habit by the ages of 4 and 5. So at which point of time, they may actually have a gap between the front teeth, upper and lower front teeth of their baby teeth. We call it anterior open bite. But if they eliminate the habit before the permanent incisors come out, as in this case here, which the patient did not eliminate the habit, the permanent incisors erupted and anterior open bite form, with the upper incisors being quite proclaimed. That's right. Yeah. If it is resolved before the permanent incisors have erupted, it should resolve spontaneously. However, once this has occurred past a certain stage, it has to be treated by braces.
So pacifiers and thumb sucking actually affect the growth of the teeth, but what about the gums? Will it create your gums to change shape also? I don't know.
No, not really. It's just really just the teeth alignment. Yeah.
But it's amazing, I guess, if you think about it logically. I mean, because when you're sucking, there's all this pressure pulling forward,
right.
But let me ask you then, because we know we lose our baby teeth, we all have a brand new set of teeth at a certain point in time. Does that mean it's fine to go ahead and do that as a kid because you're going to have a brand new set of teeth anyway?
Yeah. Yeah.
Permanent incisors, right?
Yeah, that's right. That's right. I mean, they can, but they have to discontinue a habit before the adult teeth come out. So
Which
that
would be age of 4 and 5.
At 7 and 8.
7 and 8.
7 and 8 years old. Yeah.
And pacifiers, I hear that is better than the thumb, in some extent. But is there any truth to that?
Is it better? No, it's just that it's easier.
I've been told that it's less, in terms of the negative outcome, is a little bit less than if you had a...
Yeah,
softer, and you can't sterilize it compared to the tongue. You don't know where the tongue has gone to, you see. Yeah.
So what are the corrective treatments? I mean, the most common ones are retainers and braces that you say. Are they the only option today, or has dental medical advancements seen new breakthroughs?
Well, you can have the option of putting braces that's conventional on the front, but currently there's an increasing trend in people actually putting braces on the inside, or they can actually have the option of what we call clear aligner therapy, which is really a series of transparent, customized plastic splints that apply forces in small incremental steps to move the teeth into their ideal positions. Yeah, so it's not at all obvious as having foreign objects bonded to your teeth. And this plastic splints can be removed as and when you want. Yeah.
Okay, so I guess the main key is don't put funny stuff in your mouth. I mean, to start with. All right, thanks a lot, Doctor, for coming in and speaking with us. Just speaking with Dr. Michael Mah, an orthodontist, about some common bad habits which can affect your dental health.
That's right. We all want a nice, set of teeth so that we can have the so-called perfect pearly smile.
We're off for a short break here on Primetime Morning. Do stay tuned. There's still lots more coming up in just a few minutes.
Stay with us.